Hey Doc audience, we have a special Hey Doc for you today. We've got some real experts in studio with us. Rod, we're going to talk about the biggest misconception of plastic surgery. People are on social media and the internet and they think plastic surgeons just drive like Ferraris and just do like cosmetic surgery, but the scope of plastic surgery is so much bigger than that, and you would know better than anybody. So what do you think?
Well, I agree, Bill. I mean, social media has kind of blurred the lines. And, and I get people saying plastic surgery, like you just operate on plastic or use plastic. And of course, it comes from the Greek word to mold and to make. So we do everything. In fact, we're the most highly trained physicians anywhere because of our training, our 6-8 years of training after medical school. It's a long haul, and we do everything. There were days when I would do a toe to thumb transfer, and then the next day do a facelift. So we're just all over. We basically operate everywhere in the body, and I think that's the beauty of plastic surgery. But it's a long haul. Real surgery, real surgeons, and real operating rooms, and potentially real risks.
And we've got some incredibly talented expert plastic surgeons with us. Renee, I'll start with you. This is a real topic, right? People have no idea.
They have no idea. When I was in my training,
tell us about your training.
So I did a total of 9 years of surgical training. That's after your 4 years of medical school, because I did a full 5 years of general surgery. I only took my boards in general surgery. Now, I'm not taking your gallbladder appendix out anymore these days, but I was boarded in that. And then I did my plastic surgery training, and then I went and did some private one-on-one fellowships so I could really hone in on my expertise. And, one was, it feels a little bipolar. One was on craniofacial surgery and all the trauma of the head and neck, and then one was on aesthetic and cosmetic and oculoplastic, but it's to make you the best well-rounded person. And the motto at my training was, we don't say no. If they can't do it, we can do it. Fixing an AV fistula in the middle of the night, I never forget that one. Or then you're going and putting a finger or a thumb, like you said, back on, or fixing a jaw fracture, managing the burn unit, and then breast reconstruction. People ask, why'd you go in? Because you can operate head to toe.
That's really what makes you the best of the best. And I think that's why, you want to go see a plastic surgeon.
Yeah. Armando, this is something that I'm sure you see. People they have no idea how long it takes to become a plastic surgeon and how well trained people are. That plastic surgeons actually do craniofacial, cleft lips and palates in children and molding in their heads and hand surgery, right? I mean,
absolutely. One of the things I always think about is, plastic surgeon as the surgeon's surgeon, right? When other types of surgeons get into trouble, they call us. And they trust us to get them out of that trouble and help their patient. And it's because of all the training and our anatomical expertise from head to toe and our ability to work with children and older people. It's a responsibility that we all take very seriously. So the problem with the perception that you get from, watching too many plastic surgeons dancing around on Instagram is that, we don't take it as seriously as other doctors do, but we absolutely do. It's very important. What we do is elective most of the time. And so I think that the majority of the plastic surgeons I know, certainly everybody here at the Plastic Surgery Channel, we practice with a greater degree of integrity because of the nature of what we do. And I think that's important to point out.
I think, too, it's really important. There's a lot of things you see on TV. You don't realize a plastic surgeon's involved. Remember when a very famous golfer had a very bad fracture on a leg? And you don't understand, if you break, or athlete, you break your leg in that right spot where you can't pull skin over to close. You got to bring tissue from somewhere else, and guess who does that? A plastic surgeon.
Right.
We are as integral.
The innovators that ultimately other fields then take our accomplishments. A lot of people don't know the first kidney transplant was done by a plastic surgeon.
We work with neurosurgeons, orthopedic surgeons, urologists. We work in conjunction with all these people. So it's such an awesome field.
It is. It's why we all went into it.
Yeah. And so, John, don't you think that that scope, again, everybody here at our little round table here, we all are primarily the aesthetic surgery now, but that's not what we started doing. We did a lot broader scope when we first started our practice, and actually still do some of that, but don't you think some of that actually helped you now in your career? Some of the things that you did, say, that you don't do now, that's why plastic surgeons are so technically refined compared to some other surgical specialties. Do you?
Yeah, I think that's absolutely true, because we know how to handle just about any potential circumstance that comes up. Because surgery is surgery, and every now and then you're going to have to fix something. Sometimes it's your own situation. I mean, if you're honest about it, but if you're properly trained and you have the wealth of knowledge, then you're able to deal with that and bring things to a happy conclusion. And I think that's one of the differences. I think it's also true in the general aesthetic field. You see a lot of people with minimal training that are putting in fillers and this, that, and the other, having complications. We as plastic surgeons fully understand the facial anatomy, so we're perhaps better able to stay away from trouble spots.
Yeah.
Well, you bring up a good point, though. This is why you want to go to a board-certified plastic surgeon, not a cosmetic surgeon, not a general surgeon that dabbles in aesthetics. You want to make sure they are board-certified because you see what we are doing.
Yeah.
Right. Know before you go.
We've had some great expertise here. What do you think? What do you think? Did you know that we do all this different things that we've been talking about? Let us know in the comments. Make sure you subscribe, and we'll see you again on Hey Doc.